Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Today, co-hosts Stephanie Desmond and Josh Sharfstein join me for a recap of Public Health on Call in 2023 and what we're thinking about for 2024. Let's listen. Stephanie Desmond and Josh Sharfstein, thank you so much for joining me and everyone else on Public Health on Call. Welcome to the end of 2023. We made it. And so we're back for another one of our sort of recap conversations that we've done every year. This was an action-packed year, and I think I'd like to start off by asking, what are some things that we learned? What was new and different this year? So, Josh, let's start with you.
Well, I think this year for the podcast really illustrated how many topics are public health topics, because just scanning through the list, we hit everything from cosmetics to psilocybin to ChatGPT to zombies. You know, there were many different topics. And I'm sure, although we haven't calculated the statistics, I'm sure that we had the fewest number of COVID episodes in 2023, although there were some good ones. We really have seen the podcast expand its horizons and really go to a lot of topics that are really important in different ways.
I can confirm, actually, that this was the lowest number of COVID-related episodes that we've had since the start of this podcast. And for a podcast that started out as pretty much a COVID podcast, I would say that's an interesting evolution. Stephanie, what'd you learn this year?
Well, I learned, Lindsay and I were actually together when we learned this, that we just record the podcast, right? We do the research, we record the podcast, and we send the files, which are fairly short, to our editors, who then takes hours for them to put together every episode. And I had no idea. And now I feel guilty, like every time I open my mouth on the podcast, thinking that's like one more period of time that they're going to have to spend editing us.
And that's for the easy podcast, by the way.
Right. Those are the ones that we don't mess up at all.
I know. And like listeners should know that recording a podcast, like we record all of these as though they were live. But there's always moments in conversation when things don't go according to plan, or like for me personally, my cats walk through the frame or make some noise, you know, something happens, has to get edited out. So a big thank you to our editors that make every episode sound so seamless, because they certainly are not all recorded that way. But I do want to talk about like what were some memorable episodes. Stephanie, tell me about a memorable episode that you recorded this year.
So I was just reflecting recently on an episode I did, I think it was in the spring, with Dr. Helene Hedian from Johns Hopkins. And it was about legislative attacks on LGBTQ healthcare and trans care that we were seeing across the country. And the stories she told were just, there were stories about positions that people were put in that I could never have imagined until she put it to words for us. And excitingly, that episode has been nominated as it's a finalist for the Anthem Awards. And you can go to the Anthem Awards website and vote for us to win an award. Unfortunately, we are up against Taylor Swift. So
Who? No, I'm just kidding.
So, I don't know if our chances are so good.
I don't know. We'll see, because previously, first of all, that was an excellent episode. And if you missed it, you should go back and check it out. And we'll link all of the episodes in the show notes today that we mentioned here. So we also won a Signal Award this year for our Black Maternal Health podcast series. And in that category, we were up against Michelle Obama and Goop. And so we managed to somehow land that one. So I do have high hopes for these other awards.
Everyone has to go out and vote right now.
Yes.
Follow up on your...
I certainly remember that episode because I remember her talking about the patients that she has, right? And the stress that they're under as a result of these legislative attacks, and really just the uncertainty and anxiety that caused. I think that was an excellent episode and deserves not just podcast award, but hopefully some appreciation out there in the world, maybe to make things a little better.
Yeah, families are having to move in order for their kids to get care. So let's talk about some other memorable episodes. Josh?
Well, early on, I interviewed Judge David Tatel, who was in the U.S. Court of Appeals for the D.C. Circuit and is something of a legend in the legal world. He was speaking about some Supreme Court decisions that have vast implications for public health agencies. But I heard from pretty much everyone I know who might have come across the podcast and is a lawyer about how amazing it was to get Judge Tatel on the podcast. And maybe we'll try to get him back next year because the Supreme Court is making some additional really important rulings this term on the same topic with enormous implications for whether or not agencies can actually respond to public health challenges under the law without an express act of Congress. And even then, sometimes the Supreme Court may say that that's not enough. So it's really a pivotal moment for the courts in public health.
We actually talked a lot this year about the roles of some of these agencies. And we did a lot of retrospectives this year about the COVID-19 pandemic and things that didn't go according to plan. And we've also talked a little bit about planning for future emergencies. And a big thing that came out this year that we're still kind of experiencing is the fact that the end of the COVID-19 public health emergency has had all of these knock-on effects because there kind of wasn't like a great runway plan after that. And so what's some of the fallout that we are seeing from the end of that? And also, I guess, the end, quote unquote, of the pandemic. Josh, let me go to you first. Do you want to talk a little bit about what we've discussed this year?
Well, we certainly have talked about how respiratory viruses interact with each other. We talked to my former medical school roommate, Ashish Jha, on the podcast about the triple-demic of RSV, flu, and COVID, and how this is part of our new normal, and we have to be alert. We've also heard about how there are big efforts to help people become alert, a whole new federal effort to have a weather report for pandemics, and not just pandemics, but infectious disease. Just like you might grab an umbrella on the way out the door, in the future, we may be grabbing masks. So I do think there's some immediate implications. And then, of course, we've talked about some of the underlying challenges to our public health system that the pandemic has exposed and really which haven't been addressed yet. And in many different ways, we've tried to highlight dimensions of that. And there are some responses that are out there, but we heard from a 9/11 Commission type report by the people who did the 9/11 Commission about what the country needs to put a public health system back together. And we really have to hope that people are listening, if not to our podcast, to that message.
I do think people are listening. And we actually do have some big fans of the podcast. So first of all, we constantly get emails to publichealthquestion@jhu.edu. Little plug there. You can always email us with your suggestions or any feedback you have for us. I do want to give a shout out to a group of MPH students at Johnson & Wales University. So they listen to our episodes and they actually have like discussion questions around them, which I think is just fantastic. And I also have to give a shout out to our biggest fan, Joe from Hawaii. And he says that throughout the pandemic, this podcast really helped. He was working for a consulting firm and they really helped lead the statewide COVID-19 vaccination program. And CDC ended up ranking Hawaii up at the top for vaccination rates. And he says, his quote, "I'd say the podcast had a hand in helping us earn that achievement." So I do think people are listening. Let's pivot a little bit here and let's talk about what are we thinking about for next year? You've mentioned public health is a vast umbrella term for all the ways in which these things touch our lives. Stephanie, let's start with you. What topics do you think that we'll talk about in 2024?
Well, I can't imagine we won't sneak in some COVID podcasts in 2024, because even though it's officially over, we're still seeing COVID cases and the government is still sending us free tests. That's also a plug. If anyone wants some free COVID tests from the government, they just had to go to the government and get them. They'll mail them to you. I also, one topic that I have done some episodes on and I expect to do more is suicide and the underlying factors. And there was just a recent report that said, I think the suicide rate was the highest it had been in 80 years, which I assume is the Great Depression. There's a lot to be unwrapped in terms of mental health and in terms of guns and in terms of all the things that go into that. And I'd like to explore that more.
Josh?
I remember that one of our most popular podcasts of the year was a podcast about bias in artificial intelligence and machine learning. That was a great interview with Khadija Berriman. And maybe 3 or 4 times the listeners of the average episode. Part of me wishes we weren't entering a world where we're going to need more podcasts about artificial intelligence and public health. But I think that is coming, both maybe the opportunities to make things better through artificial intelligence, but I'm sure also some of the potential concerns that are there, like Dr. Berriman talked about.
There are several topics that we covered this year that are certainly not one and done. Among them, like drug shortages, we've talked about cancer treatments, we've talked about stimulant medications. A big one, I think, Stephanie, you covered this quite a bit, is the climate change emergencies. We covered air quality, and this past summer was just absolutely brutal for huge parts of the US in terms of temperature. And so unfortunately, I think that's something we're going to continue to talk more about. Josh, what else are we thinking about looking ahead for next year?
Well, recently we put on a podcast with Michael Shipler about peace building, and the absence of peace building is kind of in the news these days. And I hope this is a topic, first of all, very important to public health, and something that we can be covering more in the weeks and months ahead.
I want to do a little recap of some promising news for public health, looking back over the last year. Stephanie, what did you cover?
So we have over-the-counter hearing aids have been approved by the FDA, which I keep sending the episode to my father to see if he can maybe learn a lesson from that about how you need to counteract your hearing loss, or else there can be dire consequences. Some Hopkins researchers are making progress toward understanding what mosquitoes are attracted to that could help with malaria treatments down the road. This was a really interesting one. We did a piece with Shima Hamidi about traffic lanes. And it was sort of this whole counterintuitive idea that wider traffic lanes are actually more dangerous than narrower ones, because you think people it's good to have more room to maneuver, but really what people do is speed. And so how she's hoping that we'll see a lot of changes in that going forward.
I could add the RSV vaccine and the fact that it offers both older adults and little babies, ones I used to take care of in the hospital, some relief from just a really horrible condition. We just need to make sure there's enough of it now. And then really interesting, some of the first data about overdose prevention sites in the United States. We talked to Brandon Del Pozo about his study, finding that there isn't more crime around them, which hopefully will address some of the concerns some people have and maybe bring a intervention that has evidence behind it into more areas with continued data collection and assurance that it's having a positive impact.
I will add that as a public health communicator, this year brought a standardized schedule for annual COVID vaccines with some very clear-cut guidance, which is incredibly welcome after the very complicated charts that we used to have to try to get out there about age ranges and boosters and all these things. So that is certainly a win as far as I'm concerned. I'd like to just wrap up with any final thoughts you have about the year and what you're looking to for next year. So let's start with Josh.
I'm still kind of stuck on the podcast with Dr. Iwashnia and his son, where they sit around watching science fiction movies, yelling at the screen. One of the things they were very upset about was that Darth Vader was not offered oxygen at the end of Return of the Jedi. And I now can't watch a movie without wondering what they would be saying to each other about what's not being done, no matter what the setting, species, or time era is happening. So maybe it has ruined movies for me, but hopefully in 2024, I'll be able to forget that episode.
I mean, we could have a whole spin-off podcast, A, just with the two of them, but B, just with pop culture commentary from the public health viewpoint, because we also talked about depictions of pandemics in movies. That was a great episode too. Stephanie, I want to ask you, because you kind of came to this project in the beginning thinking that you'd do a few episodes just to help out. And here we are, almost 4 years later. What keeps you coming back?
I love interviewing people and I love asking questions that I really have no business asking. And I love when I hear about something, I always want to investigate it more. So at heart, I'm a journalist and I haven't been able to flex those muscles as much since I've been at Johns Hopkins for the last 14 years. But it gives me an opportunity to use some of the skills that I have honed over a long career.
Yeah, we all have very different interview styles, by the way. My style is like whoever I'm interviewing, at some point during the interview, they're going to think to themselves, how's she going to thread this needle? Like that's the style I like to go for. Yes, Josh?
My style is, I think, what would Stephanie ask?
That's just in the back of our heads all the time. All right. Well, thank you both so much for making the time for this end of year wrap up. It has been a long year. We are looking forward to some great episodes coming up. And thank you, by the way, to all of our listeners. We listen to what you say. We love your feedback. We love your ideas. And I mean, ultimately, we are here for you. So happy end of 2023. And I look forward to seeing you all in 2024.
Thanks, Lindsay.
Bye-bye.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.